Hi, everyone. It's Dr. Erin Stubblefield again with the KMC University Help Desk. With back to school and fall youth sports in full swing, you may be seeing more new patients in your practice, and specifically those of the pediatric variety. However, don't let their age fool you into treating them differently when it comes to how we code for new patient visits. Just because they're in middle school doesn't mean they require less time and effort to diagnose and treat. We had a question come through the help desk on this very topic. Well, my patient's only 12 years old, so they're way too young to have a complexity high enough to bill a 99203, for example. The doctor automatically assumed that because of the patient's age, it was going to automatically mean a lower code. But the coding rules changed in 2021, and the way that we think about evaluation and management, or E&M codes, also changed. In 2021, there was a big shift in the E&M coding for office and outpatient visits, specifically the 99202 to the 99215 codes. Before that, choosing the level of code was based on three key factors: history, physical exam, and level of decision making. You had to meet specific criteria for a certain number of those components in order to use that specific code. It often led to doctors documenting a ton of stuff that wasn't really necessary for the patient care, just to justify billing a higher code. This was a huge pain, and it led to a phenomenon we call note bloat. But on the flip side of that, it also meant doctors were undercoding and leaving money on the table for patients who were younger and therefore assumed less complex. So this update was a game changer because it simplified everything. Now, for those specific code ranges, 99202 to 99215, you need to base your choice on one of two factors. The first is medical decision making, and the second is total time. Medical decision making, or MDM, is all about the complexity of the problems you're addressing, and it's the most common criteria that we use for E&M coding. In addition to the complexity of the complaint, you're also considering the data that you're reviewing and the risk involved in managing the patient. The MDM criteria were also clarified to be more clinically intuitive. The other criteria is total time, and this includes all the time spent by the provider on the date of the encounter, not just the face-to-face time treating the patient. This can be things like reviewing records, preparing for the visit, counseling the patient, and then documenting the notes. For example, a 99203, 30 minutes must be met or exceeded. So even if your patient is 12 years old, if they have a fairly complex complaint and you spend 30 or more minutes with them, then you've met the criteria for MDM or total time. All in all, it means that we're documenting mindfully and intentionally, rather than inflating note content to justify billing a higher code or undercoding because we think we can't meet the necessary criteria. Using total time, which will vary by code, or medical decision making, it's going to support compliance with coding requirements and also foster a culture of transparency and accountability, allowing us to serve our patients more effectively while safeguarding our professional integrity. If you enjoy this content, then follow KMC University on all of our social media platforms for more practice tips and tricks from your chiropractic, reimbursement, and compliance experts.